On this episode of Back Talk,
I think that we've seen a lot of growing technologies in the time that I've been in practice take off. It's an area where we have so much opportunity. Growth is what's important to me. Like if I look at this experience and I'm like, okay, it wasn't fun, but like we came out of it, I grew, like I learned, my team learned, whatever, then I can, that to me is the like decision that I'm gonna make is what is gonna be the growth opportunity.
your jacket is very Vegas-y. Tell me about this thing, because I seem to recall the last time we were at a spine conference together in Las Vegas, you wore that same jacket. So this must be your Las Vegas outfit.
Okay, wait.
Welcome back to another episode of Back Talk. We are actually filming live in Las Vegas, coming to you from the POSNA conference, the Pediatric Orthopedic Society of North America. And I am really excited to introduce our guest today, Dr. Lindsay Andras. She is the Vice Chair of Peds Orthopedics at Children's Hospital of Los Angeles. Lindsay, welcome to the show.
Thank you for having me here.
We're very excited.
I'm happy to be here.
Great.
So, Dr. Andras, we met through Dr. Blakemore. Dr. Blakemore was our first interview on our very first episode, and there were similarities. You both are into type 2 fun, which we'll get into in a moment. Really interesting similarities. But before we get into that, would love to know a little bit more about your background, how you ended up as a spine surgeon, where you went to school, that whole background, and who your mentors have been.
Yeah, it wasn't the most direct path. People, now I've been in LA long enough, people always ask if I'm from LA, and I am definitely not from LA. I'm an Illinois farm girl. And my father was an orthopedist, and I said for sure growing up, like I was not going to go into medicine, human medicine. I was going to be a veterinarian. And started out on that path, and then ended up switching to human medicine, but with the caveat of whatever I did, I was definitely not going to do orthopedics. And then at the start of residency, they said, what area of orthopedics? And I said, well, I've eliminated spine, but other than that, everything's fair game. So obviously, like a young me didn't know old me very well. But I think sometimes like life just kind of puts you on the path that you're meant to be on. And if you do the things that you enjoy, then you find a path that you wouldn't have necessarily otherwise have seen.
I love that. I have said about my own life, it's been a series of happy accidents, personally and professionally, right?
Yeah.
And you kind of look back at it and say, how did I get here? But it all makes sense. But it's not, me too, very serendipitous.
That's great. Intentional wouldn't be the word, but right. Yeah. It was, I think you'd be hard pressed to find somebody that loves their job more than I do.
Oh, I love that.
Yeah.
That's fantastic.
Yeah.
What do you love the most about your job?
I think, by far and away, it's the patients that make it amazing. Peds is just constantly invigorating from that standpoint. The way, particularly in the practice that I have, where we see a lot of kids with really complex spine issues that are oftentimes part of even other complex issues, and the grit and determination that you witness in these kids is like unbelievably inspiring. And then I think, this is an area where we've come really far, but we also have a far way to go. So I feel like the opportunity to make an impact in what we do is like very tangible. Scoliosis runs in families, and it runs in mine. You can kind of follow the history of treatment through our family. My aunt having had surgery as a teenager when you stayed in bed for a year in a body cast.
Wow.
And then my grandparents said, we're not doing that with another daughter. So my mother was in a bracing trial with It was a Milwaukee brace, but it seems like even a torturous version of that. And you look at like how far we've come in terms of treatment from that standpoint of how, you know, most of our kids are out of the hospital within 2 days and back at sports in 3 months, and it's just a very different experience. But we still there's still so much we don't know. So I think there's still that opportunity that is creates interest and drive.
We've seen so much change with new technology, whether it was growing rods or the tether, and so many different types of technologies. Where do you think this goes? What's the next thing that we're going to see in the next 10 to 20 years with the advent of robotics making changes, with what we're seeing with AI and deep learning? Just curious, you're at the forefront of this. You see all these different companies and technologies. If you just were to take a guess, where do you think this goes?
I mean, I think a lot of it is like, what specific component are you looking at? I mean, I think a lot of our opportunity is in detection and monitoring. And one of the things that I'm really excited about right now is we just launched a pilot program with Momentum, which is a company that allows, it's app-based, and it allows the families to do a video of the kid at home every month, and through kind of an algorithm gives you an estimated cob angle, which is so far showing to be pretty accurate. So when you talk to families, like a lot of it is like, they show up and you give them a diagnosis of scoliosis, and then they say, what caused it? And you say, well, in most cases, we don't know. And then you say, well, is it going to get worse? And you say, well, in most cases, we don't know. And while there are some predictive models, none of them have been spot on enough to really hang your hat on. So it creates a lot of anxiety for these patients and their families. And this is hopefully going to provide a tool that can not only lessen the number of visits and make us more streamlined from that standpoint, but also hopefully like kind of put the monitoring back in their hands and allow them to not be like losing sleep about whether or not it's getting worse. So I think some of that is really exciting. I think I'm hoping that we start to peel back the I and AIS, to understand the condition a little bit more. And then, I think that we've seen a lot of growing technologies in the time that I've been in practice take off. I'm really excited about Renee Castlin's Spring and how that could be potentially used. And I one of the areas, there's two main reasons I love early onset scoliosis, and that's one is that you get to follow those patients like their whole lives. So I know those kids and their families, and we really get to like watch them grow up. It's a marathon, not a sprint, but you get that level of connection. And then the other thing is that it is, I think it's an area where we have so much opportunity that piloting newer technology is seems more reasonable. I think one of the challenges with like the tether is compared to a selective thoracic fusion, like the selective thoracic fusions do really well and they go back to sports. And so it's a little harder to say like, do we want to do something that's more experimental? But in EOS, the technologies really kind of all has its challenges, and the problem is so, oftentimes really so impactful in terms of the quality and quantity of life that it makes sense to really try some of these more novel things.
Yeah, that's so interesting. Going back to what you were saying at the start of your comments, I've said for a long time, yes, the devices have room for innovation, and of course, that's our bread and butter, and as an industry, we'll keep doing that. But I think the real leap forward will be everything that surrounds the implant. So all the stuff you're talking about, predictive analytics, and just getting a better handle on what's happening with treatment and how do we get ahead of it. So I'm excited to see where it goes too. I think we're just scratching the surface, and it's going to be amazing to see where this goes over the next decade. Yeah,
like one of them, to bring it back to the POSNA meeting, Dr. Schenecker, received that grant looking at like sex hormones and the growth plate, I forget the exact title, but it's there's some kind of interesting stuff in the literature of like when they gave teenage boys aromatase inhibitors that they got scoliosis. Like, there's a lot of things that like we just really don't understand about how that process when you go through adolescence and how it impacts your growth. So I'm hoping that John and others that are working, some in the spine area and some in the non-spine area, that we'll get a better understanding of growth.
Yeah.
in general.
Interesting.
Yeah.
Yeah.
So, yeah.
It's fascinating.
Yeah.
I mean, one of the things that's so interesting about spine in general, to me, to a non-clinician, from a non-clinician perspective, is just there's so much we still don't know. And when you look at the outcomes, they're just, I've worked in other sectors of med tech before spine, and the outcomes were much more predictable. And here, I think it's just, everyone is a different experience, obviously. I'm preaching to the choir, but I think just it'll be fascinating to kind of get to a point where we can actually predict better clinical outcomes with more repeatability. And I think the tools that are emerging now surrounding the implant will hopefully get us there.
And when to intervene, right? That's been a big question. When do you decide to do this? And is it going to progress or not? And I do think from what we're hearing, I think AI is going to help us get there by collecting that data and assessing that.
Well, it's a really hard thing for families, and I will, I sit where I sit and I see what I see, and I understand the family that doesn't want to jump on something surgical from the time that we would say it's first indicated.
Yep.
There are a lot of reasons for that. Sometimes it's that it didn't get picked up. Sometimes it's that there's other stuff going on. But a lot of times it's that, my kid's like running around and seems fine.
Yeah.
And so a lot of times like they have to see it become a problem with their own eyes before they're willing to like take that step surgically.
Sure.
But the problem is that, and I actually say it if I, see them at 52 degrees, is like, all of the things that you worry about as a parent are going to get more likely, not less likely, if you wait until this is bigger. So there are a lot of times that we're doing cases that are, yes, like probably past that ideal intervention point. None of us can rewind time. But I think as we get better at, being able to really show people this is the path that you're on, as that becomes more and more tangible, then I think it will help in that decision making. Because I'm sure unbelievably scary. We do it all the time, right? Like, it's like several kids a day, and that we're having those conversations with oftentimes. And, at like a busy spine center like ours, like many spine cases every week. But when it's like your kid, that is, and especially if like they don't seem bothered by it, that's a weighty decision.
For sure.
Yeah.
So speaking of that, we're ramping up here for Scully season. Is your summer just going to be insane? How does your volume kind of move throughout the year?
Yeah, I mean, it goes up a little bit, mainly because they open up a little bit more OR time for me, and also for me, it's more of a shift of the otherwise healthy teenagers that just have scoliosis.
Yeah.
My volume's a little bit steadier through the year, but a lot of my practice is early onset scoliosis or kids with other neuromuscular conditions and things like that. In all fairness, I think the beginning of summer is like a really tough time to have surgery. I think a lot of times the kids are not enthusiastic about that decision at all. Every now and then you get one that's like really focused on school and didn't want to miss any classes, but a lot of times they're like, wait, no, I could have done this during the school year and be able to enjoy my summer. And it's like everything's hot and sweaty and you can't swim. And it's like so, it is, there's a lot of factors that go into the decision in timing. So, everybody has their own set of own algorithm from that standpoint.
Yep.
So I'm curious, when you take care of these children, they're part of your practice for so long. How long do you follow them? Do you follow them their whole life? How often do you talk to them? I'm curious.
Yeah. We have kind of usually we transition them at around 21, but sometimes I see them through 25. And a lot of them I've gotten to stay in touch with after that. I give the patients that I operate on my cell phone, and I would say it's almost never abused. But I do get like pictures of college and high school graduations and winning athletic events, and it's really one of the super fun parts of my job.
It's got to be so rewarding.
Oh, definitely.
That's amazing.
Yeah.
Because you really are changing lives, one patient at a time. It sounds cliche, but you are.
Yeah.
And you get to see it.
And you get to like go on this, journey with the family and see I always tell them, like, I wish I had a fast forward button for the first couple of days after surgery, but they get through it. And then, you know, kids are so amazingly resilient, and you see them just continue to grow and thrive. And it's really fun to be a part of that.
Do you have any particular websites or social media outlets or places that you point the teenagers to go to, like Curvy Girls or any of those locations, to help them through this process from a social perspective?
Yeah, less so from websites. What we really have is some kind of ambassadors. We're actually starting a group at CHLA that we're calling Conquer the Curve. And we're going to have our first kickoff luncheon in a couple weeks, where we're going to have like activities and people can bring their families. But even before we're kind of taking it to that step, I have a list of patients, and so the nurses have an amazing memory, so we're pretty good at being able to like say like, oh, I have another soccer player that's like this far out, or a lot of times the kids with rarer conditions too. Like I have, some patients some of these kids have never met somebody else with their condition, and we're able to like get them together, and that's been really fun too.
I have to believe that's really important, not only for the patients, but also for the parents.
Oh, absolutely.
Of raising their children, whether they have to be in a brace or how to, what they can allow them to do from a physical perspective, engaging with friends, and how other parents have handled and managed that.
Yeah, and in fact, some of the research that we're doing with one of the hospitals at Utah, Jody Lynn, and she's kind of trying to delve into this question of like surgical decision making and what guides people, the opinions of their peers is very strong. So that is, they want to hear it from us, but then they want to hear it from somebody that's walked in those shoes too. So being able to help them do that is really beneficial.
Makes total sense, especially at that age. You know, it's a very critical age. So that's amazing. Conquer the curve. I love it.
Should be fun. We're looking forward to it.
So you mentioned that scoliosis runs in your family, and we hear this a lot. I'm curious how that affects the decision-making process when you talk to parents, mothers maybe who have had scoliosis, and then they've got a child who's dealing with it and having lived through it themselves. Do you see that often, and how does that impact decision-making?
As you know, there's about 10 to 15% incidence if you have a first-degree family member with scoliosis, which is much higher than that of the general population. And in some families, it is like particularly prevalent. So, like I have a mother, an aunt, and a cousin, and an uncle, all that have had surgery for scoliosis. Wow. But I think many of the mothers that went through bracing they appreciate how heavy of a decision that is. I think when you haven't had to wear a brace in high school, it may seem like, just put that piece of plastic on. It's going to be fun. You might be able to avoid a surgery. Like, why wouldn't you want to do that? That is not the way, in my experience, most of the parents, mothers or less commonly fathers that have been braced look at it. Most of them have pretty vivid memories of doing that in adolescence. And so that's actually one of the other things that I'm excited about is kind of the resurgence of some nighttime bracing, which I think it's still a little bit less proven, but if we can catch curves kind of in the early stages and while there's small and flexible, that may be something that allows us to kind of take that school component out of it. Because a lot of them are like, I'll wear it, but just not at school. Which is, my mother wore the one that because the Milwaukee brace held your neck up, you had to actually wear prism glasses to see your desks. So as if the brace wasn't bad enough, you had to put these things on. So she had very vivid, not wonderful memories of that. So.
Wow. Amazing.
And was not alone in that endeavor. So we have come a long way.
Yeah. It's fair. We need to take a step back and look where we started.
Yeah.
We absolutely have come a long way.
Still a ways to go, but yeah.
That's great.
Yeah.
So shifting gears a little bit, let's talk about your life outside of work. I mean, obviously you love what you do, which is great. I think that passion translates inside and outside of work. So tell us a little bit about how you enjoy your outside of work life.
Yeah, so skiing and sailing are kind of my two main hobbies outside of work. I there's something about being out in nature, and I think ocean or the mountain, like they make you feel small in a good way.
Yeah.
And definitely you can challenge yourself in those arenas. It is, I think I would not embrace a hobby that was didn't have a component of intensity, because like, no disrespect to people playing pickleball, but I'm probably, if I'm doing something like that, my mind tends to drift back towards work. Like, I think sailing's like a very good active relaxation, because there's like enough going on that I kind of pay attention to that, but not, but it is relaxing. I've never been able to get into meditating. I don't know. It's like,
that's so funny. We were talking about meditation, and we agree.
Probably with Skeggs.
Yes,
Yep.
it was with Skeggs, and he's very much into it, as you know.
He's super into meditation, yeah. And I tried, and
we said the same thing.
Yeah,
like
that's
our
exactly
minds are
right.
too.
Yeah.
I love this concept of active relaxation. That's fun.
Yeah.
Because you can relax and be active at the same time.
Yeah. So
How long have you been sailing?
Sailing really, well, gosh, I was probably 5 when my dad got his first sailboat for himself. So
Did you ever compete?
I didn't. No. I was more of a skipper than a captain for a long time, and then when I moved to Los Angeles, kind of like went through doing a little bit more training and bought a boat and all that kind of stuff. And
So have you ever been caught in a scary situation? In a storm?
I mean, it is. I'm going to get the phrase a little bit wrong, but it's something like the difference between an experienced and an inexperienced sailor is the experienced sailor has gotten into messes that the inexperienced one hasn't even dreamed of.
Oh, wow.
So very memorably, I knocked my father out of the boat when I was about, I don't know, 9 or something, when we were sailing, and
Wow.
that was he was able to grab onto the boom and then give me directions of how to turn the boat around so he could
Wow.
climb back in, which was good. And then
Wow.
then we got back, and he had clearly been soaked from head to toe, and my mom said, I don't want to know what the story is, but you two aren't going out by yourselves anymore.
So it's like a warning that if we ever go sailing with you, we should be careful, it will be knocked off? Or?
No. I think my skill set, since that hasn't happened since I was like less than 10 years of
Okay,
age,
there
so
you go.
I haven't knocked anybody off since. So I think
Do you do long sailing trips, or is it more like day trips?
mainly we do to Catalina Island, which
Yep.
is about a 5-hour sail, and then I would describe the environment there as it's kind of like a tailgate where everyone's on the same team. You
fun.
pick up like a mooring ball and you stay for the weekend and can go in and out to the island, and it's it's a really, you can see the lights of Los Angeles in the backdrop, but it
Amazing.
seems like you're a million miles away. It's like feels like a different country.
Love it.
Yeah.
That's great. Yeah, so this concept of type 2 fun, we've been talking about that a lot too.
Yeah.
With some of our different podcast guests,
Yeah.
and many of us at High Ridge also love that attitude of just work hard, play hard, and
Yeah.
like you said, activities with intensity, right?
Yeah.
Type 1 fun is great too, sipping a margarita on the beach, but type 2 fun just feels a whole lot more fulfilling.
Yeah, exactly.
Push yourself, challenge yourself, and I think it's a great way to quiet the mind too.
Yeah.
For those of us that have very busy jobs.
Yeah,
So.
and I think actually I was at something with some of the hospital leadership like a week ago, and to quote one of the people in our C-suite said, like, I just decided like growth is what's important to me. Like if I look at this experience and I'm like, okay, it wasn't fun, but like we came out of it, I grew, like I learned, my team learned, whatever, then I can. That to me is the like decision that I'm going to make is what is going to be the growth opportunity. My grandfather, who was had worked his way up in a company and was very successful, he would always say, if you're not green and growing, you're dying on the vine. And I think there's a lot of truth to that.
I love that.
Yeah.
Always pushing forward.
Totally.
Yeah.
I think some people, it's interesting, some people, especially leaders, you have two different types. Ones that are always seeking to learn and say, how can I get better? And those that I think cap out and feel like, okay, I know everything, kind of an armchair quarterback, versus somebody who's always seeking that. And I think, I'm biased, but I think those are the leaders who really continue to excel, are the ones that are always seeking that and that challenge.
Well, you know that like if you're always the smartest person in the room, you're in the wrong rooms.
Yep.
And I think one of my greatest joys has been being surrounded by really smart people that, you know, make me grow and challenge what I think is intuitive. And sometimes those assumptions are really off,
Yeah.
you know, but if you don't have people around that challenge you, then you never learn.
Totally agree.
Yeah.
So you're a leader in the space, you're busy. I'm curious, I bet people would love to know, what's a week like for you? Like a typical week when you think about seeing patients, administrative work, surgery days. Like I'm sure there are some changes, but generally what's a week like for you?
So Monday is like a full day of clinic. Tuesday and Wednesday
How many
are
patients are you going to see on a day of clinic?
roughly 30. So it's about 30 patients usually. And then OR Tuesday and Wednesday. Thursday, every other Thursday afternoon I have some admin time. But that other Thursday I have clinic in the morning at main CHLA and then clinic at one of the satellites. And then Fridays I have sometimes OR time and sometimes catch-up time. That's the variable. So.
And then you work in sailing on the weekends, skiing on the weekends. Yeah.
Yeah,
great.
and some work on the weekends, but also you know, I enjoy the fact that like you can do a lot of things from anywhere, right? Like you can do research from anywhere, and so it's much more feel much more recharged doing that at the cabin in the mountains than in a sterile office. Yeah.
So if you had to force rank one mountain in the world for skiing, what mountain would you go to?
Oh, I mean, I love our home mountain, which is so there's a couple things that not to like let the secret out on Mammoth Mountain, but it's fantastic. If it has one of the longest seasons because it's really dry, and so it's frequent that like there's still skiing now, and in a lot of years you can still ski on the 4th of July, that gets to be a little bit of a challenge because then you have to decide like sailing or skiing, but and it's really big and very expansive, and there's like all sorts of different terrain. So yeah, that's.
And in the summer, will you do a lot of hiking?
We don't do a ton of hiking. Hiking on Catalina Island. Yeah.
Okay.
Yeah, on the island more. So
Got it.
yeah, there's great hiking up the mountains. We just tough choices.
Yeah, exactly.
Like, yeah.
I went to Catalina Island in high school. I actually went scuba diving off the coast.
Oh, yeah.
It's my one and only scuba diving experience.
Yeah,
So,
it's good for scuba too,
Yep.
which I used to do a lot of, but haven't done that much of recently. So
That's awesome.
yeah.
So are you going to do anything fun while you're here in Vegas? A good restaurant, or since the meeting is here?
I mean, I have fun most places that I go, but I don't think I'm gonna really hit the strip.
No gambling.
No gambling.
Okay.
Yeah. Not enough of that with the boat and the skiing.
Yeah,
That's right.
Yeah.
There you go. There you go.
Yeah.
Well, I think, first of all, this has been great. Obviously, really exciting to talk to you, just professionally and personally, just a very interesting, fascinating person. So thank you for sharing a lot of you with us. I think it's been really great. Our listeners are going to love this. I think being here in Vegas, we wanted to conclude with some Vegas trivia.
What is the name of the famous Las Vegas street where most major casinos are located?
The Strip.
Right. What themed hotel features a giant beam of light that can be seen from space?
Luxor.
The Luxor.
Oh, I was going to guess the Paris Eiffel Tower. Okay. No clue. Good job.
Which famous group of entertainers helped popularize Las Vegas in the 1950s and 60s?
The Rat Pack.
Okay. And
Wait, hold on. You didn't hit the buzzer. You got to hit the buzzer.
I,
She knew
gotta
that.
hit the
She
buzzer.
wins. That's
yeah,
fair.
thank you, Dr. Andras. That's a technicality.
Just get to buzz in.
I need one of those taboo buzzers.
All right. How many hotel rooms does Las Vegas have?
4,000.
Oh, you didn't buzz in. Eric?
150,000.
150,000. That's right.
That's because you told us earlier. That's the only reason I know that.
I said
Over
4,000.
150,000 hotel rooms, more than any other city in the United States. And it said you could sleep in a different room every night for over
400 years.
which would not be type 2 fun, not the best 400.
No, that's not how I want to.
No.
Yeah, no.
Definitely not.
Definitely not.
Put me on a sailboat or a mountain to ski.
What hotel is famous for its dancing fountains?
The Bellagio.
Okay. Are you from Vegas or something?
She was like, yeah.
All right, here's an interesting. What major U.S. event used to be watched from Las Vegas rooftops in the 1950s?
Oh,
I'm going to give you the, or do you know?
the atomic bomb testing.
That's exactly right.
What?
Oh, wow.
How do you know that? I'm impressed.
That sounds like it was safe.
Yeah. It's a great,
Yeah,
fun family activity.
Let's go back and do some research on the people that
Let's
chose
watch
to
the bomb.
participate.
What's the nickname for Las Vegas due to its high volume of
Lost wages.
of its quick weddings?
Lost wages.
Oh,
Lost wages? Okay, well, here are the choices. Matrimony Mile,
Oh.
Weddingville, Wedding Capital of the World, or Marriage Strip.
Wedding capital of the world.
Marriage strip.
Wedding Capital.
Lord.
That's right. And then you had a fact about this, right? How many?
300 weddings a day
300
on
weddings
average.
a day, right?
That's
That's
crazy.
amazing.
That's crazy.
And
Yeah.
302
In Vegas.
annulments.
Huh?
And 302 annulments.
Oh wait, here's a question.
Yeah.
Do you know anyone who's gotten married in Vegas?
No, I don't think
I don't
either.
I don't know.
Do you?
No, no.
But 300 people a day are doing it.
Yeah.
Just nobody we know.
Apparently, it's a cool thing to do.
All right. And which hotel features canals and gondola rides like that?
The Venetian.
It is the Venetian.
You didn't hit the buzzer again.
She's a cheater.
Thanks for joining us for another episode of Back Talk.
We'd like to thank Dr. Andres for her hot takes and spine.
Thanks for having me.
Thank you so much.
Cheers.
Cheers.
Viva Las Vegas!
It's great that we're able to film this episode live here in Las Vegas at the POSNA conference. I think it's fun to do some of these on site, and just the energy and the buzz of a society meeting just kind of adds to the overall flavor of what we're trying to do here. So it's great. Speaking of Las Vegas, your jacket is very Vegas-y. Tell me about this thing, because I seem to recall the last time we were at a spine conference together in Las Vegas, you wore that same jacket. So this must be your Las Vegas outfit.
Okay, wait. This jacket is my High Ridge jacket. See right here? I got High Ridge on my jacket.
Oh, very fancy.
It's my Vegas High Ridge jacket. It was the closest thing I could get to our High Ridge color branding. Mm-hmm. And so now I can only wear it in two places when I go to Vegas because of the colors, and also when we have, High Ridge events.
Yeah, you can wear it to
was
Colorado,
perfect here.
to the High Ridge headquarters.
Yeah, this would look great in Boulder or Denver. Walking around, I could hike in it.
Wow.
So that was really fun with Lindsay.
Yeah.
Did you like when we were going through the trivia on Vegas?
Yeah, I loved it. I won.
You know why I knew you loved it?
'Cause I was winning?
Because you stepped on everybody on every single answer. Like you didn't even go through, just bam, you always wanted to.
This sounds like sour grapes to me. I think
I'm
you're just mad that I knew the
every
answers.
answer you jumped in.
Yeah, but I knew the answers.
Were you
could have jumped in
let
too.
Dr. Andres answer one of them?
She could have answered. She was good. She had a lot of trivia.
She did. She knew.
I
a
would
lot
say
more.
I came in first place. She was a very close second, and you were a distant third.
What are you talking about? I knew the Luxor.
Yeah, you got one answer.
Okay, I knew the other answers. I was letting everybody else answer.
Yeah, sure. That's what you
Okay.
said in Scotland.
Yeah, okay, whatever. So with regard to hot takes, the one I wanted to mention here is we're at another society meeting, and there are so many of these. And it's really interesting trying to run a company, make sure that that company is relevant, out front, around the world, global. But one of the things I wanted to ask you is, what are your thoughts from a company leadership perspective on all these society meetings that you have to balance within the budget and your people and your time?
Yeah, it is a very relevant question, because I will tell you that to me, it feels like trying to serve two very important priorities at the same time. These meetings are important. We all know spine is a high-touch business. Interfacing with our surgeon customers is absolutely critical, and it's enjoyable. It's a great part of the job. The challenge, of course, is there are so many, to your point. And so what ends up happening, I mean, even at this meeting, right, you kind of move as a group from city to city, from society meeting to society meeting. And at times, it can be very expensive, frankly. And so trying to manage a budget and run a company profitably while also being very supportive of these societies can be a challenge. I think one of the things I've learned over the years is, instead of trying to be all things to all people and being a mile wide and an inch deep, really getting honed in and focused on those society meetings where we can really make a difference collectively. So I'll just give you an example. We're Triple Diamond sponsors of SRS. We've invested heavily in all of these pediatric scoliosis meetings because that's a key area of what we do with our business. So we're going to leverage an index on a meeting like this more so than I don't know, NAS, for example. We'll be at NAS, but just being a lot more thoughtful and strategic about what we prioritize, because we've got to be at these meetings. But if we're at every meeting and we invest heavily in every meeting, that would not be a sustainable business model either. I mean, I don't know how it was when you ran K2. That was a while ago now, but I think the society presence has evolved, and I think more and more companies are realizing that we've got to be a little smarter about how we do it. But I'd love to get your take on it too.
Yeah, we saw the same thing, the transition, even K2 or at Stryker. The society, there are just more and more of these society meetings, and they're all important. They're very different.
Yep.
Some more academic than others, some more commercially facing than others. But to your point, what I think has continued to happen in our industry is this movement, which is so good and healthy for the business, but to focus on profitability, or at least to have some level of being cash flow positive, right, and running a healthy business. Let me say that. Just running a healthy business so you're not running in the red.
Yep.
And you layer on top all these society meetings, and there's just more and more and more. So industry has asked repeatedly, can they be consolidated? Understand from political reasons why they often can't be. But I think your point earlier of, being at the meetings, perhaps being present, but not at the same level of every meeting all the time. And it's not that we're not supporting these meetings. It's just so difficult within that budget and the time constraint of pulling the team out of the field, right? Now, the surgeons at the meetings are fantastic, and it's a great way to engage.
Right.
But it's become an interesting balance as we try to run these businesses. So I don't think in any way a High Ridge or any of the other spine companies would pull out. It's just thinking about how we best utilize our resources to be supportive and yet at the same time balance those budgets.
Yeah, I would completely agree. And I would also say that how we have showed up to support these societies has evolved over the years. Back in the day, I've been in spine for 11 years, and even the first couple years I was in spine, it was all about the size of the booth, making a big splash on the trade show floor. And we have intentionally pivoted and shifted to focus more on research, medical education, surgeon touch points. And I have found that to be a far better ROI when it comes to our investments of these societies. So in many cases, we're spending the same amount of money, but we're spending less on the trade show booth itself and advertising and more on high quality surgeon engagement. And I think that helps to justify the investment. And I will say the partnership between industry and society leadership is very strong, and they are very open to some of this feedback that I provided over the years, where they'll let us shift that budget and make sure that we're getting something out of it. So net positive for sure, but I think something that every company out there balances, and just, always difficult to say, how do we be in all places at once and spread those dollars as far as we possibly can to serve everybody?
Yeah, and it's not specific to any one company. It's the whole industry. And I think we're seeing some of that shift. I love your comments around moving it more towards research, education. And I think I agree. We're going to continue to see that. But it's still a very dynamic industry. And it's great to see all these surgeons when we come to the societies. And it's important to be able to engage and have an opportunity to listen to the newest research.
Yep, totally agree.
Yep.
It's a hot take.